We're always looking for the best appliances to help our patients with their sleep and breathing. Hi, I'm Steve Carstensen. I'm Director of Clinical Education for Airway Technologies, and I'm here today to talk to you about the new flexTAP. I've been using these in my clinic for several patients now, and I just love the new flexTAP. This is my personal one, as a matter of fact. What I like about the new flexTAP there's several things. One of them is the blue color. I like the blue color because it can't be lost on my countertop. It can't be mixed in with other things and be misplaced. It's brilliant. All your patients are going to be using something in their mouth to help their sleep and breathing. We can't escape the presence of the device. And so the fact that this one's blue and other ones are clear and other ones are pink, it doesn't really make any difference. It's always something in the mouth. So the blue color is a little bit different at first, but I think your patients will embrace it just like my patients have. The flexTAP is a custom-made device. It's molded over your patient's teeth. And so the fit of it is brilliant. It's comfortable. I warm it up in a little warm water. It softens just enough, and I slide it over my teeth, and it fits beautifully. I love how it feels on my mouth because it's super smooth along the side. It's very thin, so it doesn't take up any tongue space any more than we have to get a fit over the teeth. It's smooth next to my cheeks, and so as I lay down on it, there's no block between my teeth and my cheeks. There's no metal bars. There's nothing to irritate the inside of my cheeks. When I have my patients in the flexTAP, because it's a durable material, I use it for a lot of my patients that are from out of town, from way away from town, because I'm not worried about it fitting their teeth. And I know that if they need to make a small adjustment somewhere, they just warm it up and fit it over their teeth, and it's just fine. It doesn't get sloppy when you warm it up. It just gets a little soft. The other beautiful thing about the flexTAP is the organization of the adjustment. The adjustment is a simple rod. It's a simple nut on that rod. And so the patients can make their jaw protrude to the extent that they need with just turning this little nut. No pins, no extra tools, no finding a little hole there. Very good for my patients with limited sight. You put it in with one hand. There's no rubber bands necessary. It's easy to keep the mouth closed with this and promote nasal breathing. Which brings me to my favorite part of the new flexTAP. The new flexTAP comes with a new custom mouth shield or nasal breathing trainer, whichever you want to call it. I'm such a fan of nasal breathing, I call it a nasal breathing trainer to my patients. Because you put this in the mouth, and we got to deal with the elephant in the room, which is this part that sticks out from between the teeth. Well, that's true, yes. Most appliances don't have that part sticking out, but you know what? The original TAP design from 40 years ago had something much like this. Over the past several years, I've made who knows how many my taps for my patients to give them a chance to preview how they would feel with oral appliance in their mouth. That stuck out of their mouth, and everybody says, well, that's weird, until they use it, and it's not weird anymore. With the flexTAP, this new nasal breathing trainer slides over top of that protrusion, and that soft silicone becomes very easy to rest the lips on. So there's no irritation of the lips either. With some of the other devices where there's an adjustable mechanism in the front, or there's a strap, or there's some other thing, their lips struggle to close over the front of that. When we have our patients with enough vertical to give their tongue enough space to live, sometimes it's challenging to get the lips to close in the first place. And on those devices, we have to use things like lip tape. With the new nasal breathing trainer on the flexTAP, the lips seal smoothly against this silicone. It's adjustable. You just trim it if you need to. And it has these little pads that go in between the arches. So that it slides in here this way. When I have this in my mouth, I can bite on it, I can chew on it, I can do all the muscle activities that my body may want to do, and it doesn't hurt. It doesn't make the jaw rigid. It doesn't hold my jaw in one place. It allows it to move so it's comfortable. There's flexibility in this adjustment. And because my lips are resting nicely against that silicone, I have to breathe through my nose. Now you might think, well, that might be uncomfortable for patients. But because of the little post sticking through the hole in the front of the nasal breathing trainer right there, there's enough airflow that I can actually suck air around the silicone, around that little post, and assure myself that in fact, I won't suffocate with this in place. Now, because of resistance, when I'm relaxed in breathing, my nose is my primary breathing port, which is what we want. But I can always put a little air through that hole, and that gives me that psychological assurance that I'm not, in fact, only dependent on my nose. So it's a more comfortable feeling that way. It goes in, the flexTAP goes in and comes out easily, so your patients aren't panicking, trying to get their fingernails under some edge of it to pop it off their highly retentive teeth. It does require a certain amount of tooth structure, so you can choose wisely on how you make that happen, but it fits so many of my patients. I'm very much enjoying the new flexTAP in my practice. It's super easy to adjust. It has a nasal breathing trainer. It has a flexible system for how they bite down on it. It supports the muscles, doesn't hurt the jaw joints. I love the new flexTAP. I hope you will too.